I didn't hear all the nice things that Jack was saying about me, but I'm sure they're all true. But the truest nice thing that you can say about me is that I've got the best senior senator in the United States Senate. And I gather that this is Surescripts recognition for e-prescribing. And it's one of those busy days in the Senate. And I just wanted to thank you all very much for the work that you have done to push this issue to the forefront. We've seen a lot of work firsthand. I see Laura Adams here from the Rhode Island Quality Institute, who has led so much of this work at our state level. From the very beginning, Mr. Blumenthal, nice to see you. We're filled with dignitaries. It has been a very important, I think, gateway for physicians to begin to get used to electronic interaction. And it's also been a very important gateway from a point of view of the often rivalrous forces in the healthcare system to have to sit down and get together and learn to work on a project that will ultimately serve the common good and ultimately serve all of their interests, but takes more than just a parochial, my foxhole perspective in order to get done. And so from both of those gateway points of view, I think it's vitally important. I was also our U.S. Attorney and Attorney General, and so from a fraud detection perspective, I know there's been a lot of talk about fraud in healthcare, particularly in the Medicare system. I think it's incredibly important to have electronic prescribing out there because once you have that data coming in, it's pretty easy to be able to run programs that look for anomalies and that can pick up the fact that Dr. X, who's never prescribed a narcotic before, now is prescribing 500 a week, or that Ms. X is picking up a prescription for narcotic Y at 5 different pharmacies. And that is very helpful law enforcement information, both from a point of view of drug prosecutions and from a point of view of fraud prosecutions. So to me, this is a very, very big win-win. And Surescripts has been fabulous at pushing this. They connected with the Rhode Island Quality Institute very early on. We had wonderful help from CVS, which took a keen interest in this, and our local organizations, the pharmacists and all, have pushed very hard. So it's been a team effort, but I couldn't be happier with where we are. And I'll close by editorializing for just 1 minute, because when I say gateway, I said that with real meaning and import. We are looking at very significant budget deficits going forward for this country. And if you're talking real estate, you're talking what? Location, location, and location. If you're talking deficits and you're looking forward at where the big liabilities of this country are, you're talking healthcare, healthcare, and healthcare. And we have the chance to do something very dramatic in our healthcare system that will reduce those healthcare costs in the out years and do so in a way that is a win-win for the American people, that doesn't require pulling people off of Social Security disability, that doesn't require pulling people off of Medicare, pulling people off of Medicaid, reducing benefits, cutting what we offer to Americans. And we know we can do it because we know that we're burning 18% of our GDP on healthcare and getting results in the 30s when we're compared to other nations. We know that we can do it better. The President's Council on Economic Advisors has said you could take 30% of our healthcare cost out without affecting the quality of care. That's $700 billion a year. That's real money. That's real savings. We're not going to get there overnight. It is, as Atul Gawande said, a process of experimentation and learning that we have to go through. It is iterative. It's more like the beginning of the aircraft industry. You know, you remember the old films where the planes would flap and then they'd flap themselves apart and they'd fall down? It took some learning. Then they started looking like kites. Then they started looking, you know, pretty cool, started looking like, you know, Spads. And then they started, and now you fly into Dulles with people in pressurized, air-conditioned comfort, with people serving you tea and coffee and barely aware of what's going on, sliding down an electronic glide slope that is making sure that everything happens right, and if you get out of line, people are warned before there's a problem. That's the kind of transition we're going to do on an accelerated basis in healthcare. It's going to be founded on electronic health records and electronic medical records, and the model that we follow with e-prescribing is a gateway not just to better e-prescribing, better care, better fraud enforcement, better drug enforcement. It's a gateway to a more complete understanding of how we can pursue healthcare reform in a way that does not have to be controversial, does not have to take things away from people, and addresses probably the biggest problem America faces right now, long term, on the economic front, on the fiscal front, which is our deficit. So when I say thank you for what you are doing to push this issue, I mean it. It is really, really important, and I'm very grateful to you, and I thank you very much for this recognition. As I said, no one in the Senate has a better senior senator than I do. Jack is a constant friend, a great member of the Health, Education, Labor, and Pensions Committee, and I'm really honored that he was here to join me today. And once again, Jack, thank you very, very much.
Senator, thank you very much. Senator, thank you very much for your comments, and I would like to thank you, and Surescripts thank you, and the nation thanks you for all your work in the DEA in terms of helping us pass the legislation for e-prescribing of controlled substances. Thank you.
May I say one thing on that? That was actually quite a fun day. If you want to have a look at a fun Senate hearing, we had the DEA folks in, and we had the HHS folks in, and we had them side by side. And that was fun, because the HHS folks were frankly throwing the DEA folks right under the bus, and the DEA folks really couldn't defend themselves at all well. And this was back during the Bush administration. So the routine was, you know, the Democrat goes on the attack, and then the Republican comes in and tries to, like, pump up things and make them all look better and ask the, you know, better questions. And I'm supposed to be the bad cop, and it was Senator Coburn, who was the Republican, to be the good cop. So I did my thing, and that was the debate, and I sort of turned it over to him to try to, you know, salvage what he could. By the time Tom Coburn was done with those witnesses, let me tell you, I was the good cop. So a very, very strong message went out that this was bipartisan and this was important, and I really appreciate it.
Well, you know, thank you very much. And all my colleagues from Surescripts know they're having a lot of fun trying to meet those requirements. So thank you. Well, today, for all your contributions to e-prescribing, we present you with the e-prescribing highest award, the Safe-Rx Evangelist Award.
Thank you.
And since we have you here, we're going to break a little bit of a precedence and also award you with the Safe-Rx for Rhode Island for once a year. It's making in the top, is it number three? Number three.
Top three.
Top three in the country.
Come on up for the photo, Laura. We're going to get our Rhode Island Quality Institute president in for the photo on this one. Once she's debadged. Here we go. Come on in here. Thank you.